91% of offenders at the Grootvlei Medium B Correctional Center in Bloemfontein have received the COVID-19 vaccination. Head of the center, Patricia Setlai, has conducted information sessions to ensure that all offenders at the center have all the relevant information about the importance of vaccines, their efficacy, as well as their side effects. She joins us now to tell us more about this initiative. Ms. Setlai, welcome to the Daytime Update. And what a feat, having received a 91% vaccination rate within your particular facility. How much work did you have to do? How strife and heavy was the vaccine hesitancy before you started on your campaign?
I just want to correct the percentage that we have reached is 97%, not 92%.
Well, even better. Well done.
Thank you. We believe that vaccination is a safe way to help build the protection against the pandemic, and it is also a tool to stop the pandemic, or rather to minimize the total number of people succumb to COVID-19 on a daily basis. So in terms of our constitution, everyone has the right to have an access to medical health services, and we know that offenders, they form part of the bigger society of South Africa. We have to mention that the objective of the Department of Correctional Services is not to lose the lives of those who are under their care, but is to ensure rehabilitation and safe custody of offenders. So as we know that we cannot keep the offenders forever in our prison facility, the Department of Correctional Services is rendering the rehabilitation programs to these offenders. They are afforded an opportunity to participate in rehabilitation programs, which will assist them after serving their prison sentence to face the outside world. And we believe that taking a vaccine is also part of preparing the offenders to face the outside world.
And I wonder, Ms. Setlai, how was the level of hesitancy? Were they all very open to receiving the vaccine, or was some of them a bit unsure and a bit nervous about the process?
It was not easy at first, because the inmates, as you know, that they've got access to the TVs, they see what people are saying. So they saw the negative and the positive comments on vaccine. So they were a little bit confused, and they were not sure whether they have to take it or not. But fortunately, and the other reason why they were hesitating to take the vaccine is because initially they were told that they are going to take the vaccine before the officials. So it was also their concern. But fortunately, we as correctional officials, we took vaccine before the offenders began to take it, and it made them to see that there's nothing wrong with the vaccine. And when we talked to them about vaccine, trying to convince them the importance of taking vaccine, we even told them that we as correctional officials, we have already taken the vaccine and we are still here, we are not sick. And the other thing that I believe it has assisted them is when they saw our area commissioner, director, Rick Moses, our regional commissioner, CDC, Motley, taking a vaccine. They saw it on TV before the last group can take the vaccine. So it made them to see that there is nothing wrong with the vaccine. And the other thing that we did, because like you are saying, there was a hesitance on taking the vaccine. What we did, there are those offenders who said, no, we want to call our families to check, to ask them, to advise them whether is it correct, is it advisable for us to take the vaccine. And we have assisted them to make phone calls. And we even utilize our officials, the social workers, the nurses, the case officers, the security officials, to talk to them, to answer to their questions and their concerns.
Have you had any COVID-19 cases or even deaths at your facility?
Up to so far, we've got 0 deaths. We've got 0 number of offenders who tested positive to COVID. We've got nothing up to so far.
And how has COVID-19 affected visitation rights, for example, for prisoners? Are their friends and families able to come and see them?
The offenders or the families of offenders, the president will inform the whole South Africa that maybe we are in level 4, we are in level 3, and we will receive the directive from a head office that offenders cannot have the visit now. Like now we are at level 2. Offenders are allowed to have their family members to come and visit them, but they have to book their phoning, and then because we don't want to see their family members visiting the center at the same time, because it's going to create a problem for us. So for now, yes, the family members, they can visit the offenders in prison.
And have there been a number of deaths, perhaps of family members of offenders who died perhaps from COVID-19 while they were incarcerated?
The family members of offenders?
Yes. Have any offenders had family members who've passed away while they have been behind bars?
Up to so far, we never received that information from the offenders, because if maybe one of the family member of offenders passed on, the family of that offender will either call us, or maybe they will come and report that one of the family member of offender passed on, and it's because of COVID-19. But up to so far, we never received that information.
And how many offenders do you have at the Grootvlei facility?
For now, we normally accommodate up to 350 offenders, but for now we've got 232 offenders.
Well, thank you very much for your time this afternoon, Ms. Patricia Setlai, and congratulations on the success that you've had with your vaccination drive at the Grootvlei Medium B prison in Bloemfontein.